Hi ladies, I'm Aoife from womenshealthdublin.ie, and in this video we're going to talk about repetitive strain injuries after pregnancy. So in those early months when baby's born and there's lots of lifting and nappy changes and sleepless nights happening, what we see clinically a lot is people getting repetitive strain injuries in their elbows or in their thumbs or in their fingers or wrists, like carpal tunnel. And something I see very interestingly that I suppose not evidence-based is what's causing this. So I would have a lot of the doctors that I work with sending me in women with things like the Quervins syndrome, which is pain in the tendon here, okay? So the test for that is you put your thumb in and then you flex the wrist down and you get quite a lot of pain along here, and it's a tenosynovitis they call it. So there's inflammation in the area, and in my clinical experience, a lot of these women will end up having injections, like steroid injections to reduce the inflammation, or be prescribed anti-inflammatory medication. And quite often it doesn't really work, or just gives them a short-term relief. So again, what I'm saying to you is not evidence-based, but just based on my clinical experience. What I find is really causing these problems is more to do with their spine, their neck, their posture after having baby. And perhaps we could argue that the pain they're experiencing is a trapped nerve, but rather than the trapped nerve being at the site of pain in their hand, that it could be coming more centrally from the spine. So again, when they often may have gone through rehab for their wrists or tried to take anti-inflammatory medication, the GP may say to them, oh, try to avoid using your phone too much, you know, or you're lifting baby a lot and that's what's causing it. And you can understand that there is an awful lot of work that's happening with the hands. But again, I tend to find when I come to their center and their spine and their posture, it makes a big difference. So if you're at home and you have that pain, you can test yourself. So the first thing you can do, for example, if you have a thumb pain, is pop the thumb inside the fingers, side bend the hand, and see if you get that pain, okay? Then try and change your posture. So sit up taller or change the position of your neck and see if you repeat the same movement. Does it feel better? Then it can tell us, well, actually the problem is coming more from the center column of the spine rather than the wrist itself. So I will have patients in here and I will sit them at the side of my bed, correct their posture, and then I might actually come down the spine, checking at the neck, coming to the middle of the thoracic spine, around the bra strap or between the shoulder blades. And often when I release a point through there, they'll say, oh my God, my pain feels better, or look, my wrist is moving much further and I don't feel that pain, okay? And so obviously we could argue baby's born, sleepless nights, weak core or tummy muscles because you've been pregnant for 9 months. So your exercise levels have changed, your tummy muscles have been stretched, you're breastfeeding or bottle feeding, you're hunched over a lot. So again, does the posture change? Absolutely. And we tend to come into this kind of, no, it's not a nice word, but mummy posture of just dropping through the back, and the bum just disappears completely instead of being lovely and lengthened and tall. So that posture takes time to come back, and really it takes time for baby to grow and you to feel like you can get back to classes and you're getting out walking and maybe the sleep is improving. So again, just based on my clinical experience, if you are suffering with long-term pain in your hands after having a baby, it's not all about avoiding using your iPhone and don't lift the baby and just wear a splint. Think about your posture and think about if you do start to improve the core and do some beginner's Pilates or some gentle postnatal work, get out walking, sleep starting to improve, how's my pain now? Rather than just going to the source of where you're feeling the pain. And obviously see your physiotherapist. And if your physiotherapist just focuses on the wrist or the hand or the tendons around there and you're not feeling improvement, you might just gently say, oh, well, I did see this video on Instagram, and could we try this, or could this be a part of the problem? So look, I hope that's helpful to all the mums out there with babies that are struggling with repetitive strain injuries. Just another thing to bear in mind. I'm Aoife from womenshealthdublin.ie.